So I would welcome Dr. Pooja Khamar, a fellow colleague from Narayan Netralaya. She is going to be talking about gene therapy for keratoconus. Is it a reality? Dr. Pooja, please.
Thank you, and I would like to thank the entire panel and AIOS for planning this session and giving me a space to talk in that session. So, going to be talking about role of gene therapy in keratoconus. Now, why gene therapy for a keratoconic, like a corneal condition like keratoconus, which is a progressive disorder? Over the years, starting from 2010, our group has worked on role of lysyl oxidase in keratoconus, and what they have proven is that lysyl oxidase is lower in patients with keratoconus, and with increasing grades of keratoconus, the lysyl oxidase does reduce. And also, if the lysyl oxidase is lower to begin with, and if you do a cross-linking for those patients are at higher risk of treatment failure, and they still can progress in spite of doing a cross-linking. And not just that, patients who have developed post-refractive surgery ectasia and SMILE, they also had lower lysyl oxidase to begin with, and that's when, like, the topographies and everything were normal, but because the lysyl oxidase was on the lower side, they landed up after surgery developing an ectasia. And we do have seen reports again at places that, you know, they have done a transplant, a DALC or a total corneal transplant, and they have also failed at times, suggesting that yes, there is a genetic disorder which we are considering. So we wanted to ask a question that can we explore the role of enhancing the lysyl oxidase expression in the corneal cells and the tissues, and is it safe and provides potential functional benefits when it comes to keratoconus therapy. Now, the ideal gene therapy is going to be something which is safe and non-immunogenic, introduction of genetic material by an able vector into the targeted cells, rendering them capable of repairing, replacing, or overpowering the functions of defective or non-functional genes for therapeutic purpose. So our hospital has developed this vector production facility, which is one of the first in India in an eye hospital, where we can produce our own vectors, and what the vectors we have chosen to produce is the recombinant AAV vectors. Now, why an AAV vector? Because those are known to have efficient delivery of genes of both dividing and non-dividing target cells. They are known to give high levels of gene expression. There is an absence of viral genes for causing an undesirable immune response, and it helps us to have a successful in vivo administration to patients without significant toxicity and excessive immune reaction. So that's why an AAV-based vector gene therapy. Now, this study is a 3-step. We have reached the third step, and soon we are going to start the clinical trials as we've gotten the approvals now. So the first step was to do injection of this vectors, LOX vectors in one eye and the controls in the other eye in an ex vivo cornea model. And once it was injected inside the cornea, post 6 weeks, we studied the expressions of these genes like lysyl oxidase, collagen 1, 4, and MMP9. Now, what we saw was that when we injected the lysyl oxidase, the levels, not only the expression increased for the lysyl oxidase, but you can also see that the collagen has started resynthesizing, and it increases the levels of collagen 1 and 4. But what advantage we saw was that it was not only increasing the collagen expression, but it was also reducing the inflammation. Now, inflammation and keratoconus goes hand in hand. Whenever you have inflammation, there is a higher risk of progression. So this was giving us a dual benefit, that it was not only enhancing the expression of lysyl oxidase and collagen, but reducing the inflammation as well. The second step, we wanted to see how does it behave in a donor eye, in a human eye. So we took the human donor lenticules from the SMILE procedure, which were not discarded, but they were used for the same study. And one part of the lenticule, one eye of the lenticule received the lysyl oxidase, and the other received the control. And again, the similar results what we saw in the ex vivo cornea model were replicated here as well. Now, the third step was to see that what actually happens, what we are seeing in the gene expression analysis, the quantification. Do we see it qualitatively as well, and are we able to, like, is it like, because the collagen levels are increasing, is the strength of the cornea increasing? So this was done in whole eye globe from a donor which were not suitable for transplantation. We created a pocket, intrastromal pocket, which can be used for Khamar implants, like an intracorneal ring segment. And again, one eye was used to inject the lysyl oxidase vectors, and the other was the GFP. And you can just clearly see in these two images, this is the control image and this is the lysyl oxidase image. The spacing, the white spacing here, what you can see is nothing but the green bundles are the collagen bundles, and the white spacing besides them is the gapping. But whenever you inject these vectors, you can see the spacing between them is reducing, and the blue color effect, what you can see, the collagen bundles are increasing in phase. So it's not just the quantitative effect what we see, but the qualitative effect as well. Now, atomic force energy is something which can be used to study the structure and mechanical properties, and it can be used to measure the stiffness of the thing. So again, you can see here that the eye which received the lysyl oxidase, the elasticity does increase, in saying that the Young's modulus and the stiffness of the cornea is increasing. And this was seen not only in the cornea, goat corneas, but in human donor globes as well. So yes, gene therapy in cornea does have novel insights. It helps in developing non-immunogenic vector, and it also looks at the patient safety. And what is the best advantage when it comes to cornea is we do have imaging modalities which allows us to see the structural changes and the biomechanical changes and whether it's really affecting it or not. So lysyl oxidase gene therapy may be a potential treatment modality for keratoconic patients in future, where transplants are not an option or where cross-linkings have failed. Thank you.
Terrific work, Dr. Pooja. Dr. Sheetal, any comments on this?
This therapy currently you are utilizing for keratoconus patients.
We will be doing it for keratoconus. My colleague Dr. Poorna and Dr. Thiru, they work on the retinal front. So I'm working on the cornea front for keratoconus.
So how long does it take for to see the changes in the confocal or with the imaging? That
so
you saw the bundles, that
so
the
this
spacing
was
was
done
reducing.
at 30 days post-treatment.
Okay.
But so as I mentioned, we have received the clinical trial approval, and we may start anytime between April or maybe next quarter. And I think that time we will have to see effect at day 1 month, 3 months, and so on.
So these were
This
porcine
was,
cornea?
this was on human corneal globes,
Human
the
corneal
ones, yeah,
globes, okay.
cadaveric eyes.
So
And
if
the
I'm getting the
lenticules.
future correctly, if I'm envisioning it correctly, what we are going to do is basically we're going to inject this, we're going to correct the keratoconus, and then we are going to correct the refractive error.
I
Or
will
make the shape
not
better.
say that you're going to correct the keratoconus. I will say that you are using it in patients who basically are trying to avoid a transplant for these patients. And as I mentioned, when the lysyl oxidase or collagen levels are on the lower side, your cross-linking effect may also fail. So this would be an injection, like when you inject and increase those levels. So even if tomorrow you want to do a cross-linking or a transplant, it may work better. So the aim is not to reverse them back to normal, but to stabilize them.
So
And
early keratoconus cases it can be done.
probably moderate to high keratoconus cases.
Okay, so in early cases, cross-linking, the regular conventional.
Conventional cross-linking or a medical
treatment,
cross-linking,
yeah.
what we have been working
And
on.
for the moderate and high gene
Yes,
therapy,
yes.
with or without cross-linking?
Yes.
What she's looking at is that, you know, in rats we know that it is increasing collagen. Initially, because we'll have to demonstrate safety first, right? So initially we are going to take advanced cases, do this, look at how they do, and efficiency will come later. So too early to say that we will be preventing keratoconus, but we'll be definitely managing them better in the early part. Once the safety is established, efficacy will come along, and you know that will give us more knowledge to really say that we can use drops or injections to the cornea rather than replace
Do
it.
you also see its applications in refractive surgery?
So yes, if you have a poster, so what we are working on, you are well aware with it, we do work on various kits which can measure the lysyl oxidase levels, and we want to do that because one of the factors what we have seen is post-refractive surgery ectasias is because of low lysyl oxidase and collagen. So tomorrow if you feel that, you know, everything is healthy but the patients have lower levels, when we have, which will be maybe few years down the line, when we have this in a drop format, probably treat them with drops, enhance the expression of lysyl oxidase collagen, and maybe 6 months or 1 year later do a refractive surgery. But
Even
that's
if
a very long
I know, but
dream.
even if lysyl oxidase, that kit is not yet available and this is available, in early cases of ectasia, do you think it can also help?
Yes, definitely.
How it works in
Definitely,
keratoconus,
yes,
right?
definitely.
Pooja, yeah, I mean,
Yes,
I
sir.
am a retina specialist, but I have a slight inclination for basic science research. So my question is, for me, diseases like keratoconus, even a lot of retinal diseases, the pathology is kind of multifactorial. So are we confident on addressing this one part and then taking care of the keratoconus overall? What's your
No,
comment
as
on
you
that?
said, it is a multifactorial disease and there are multiple factors. So this therapy would probably be working well where you know that there's a genetic defect, where you know the lysyl oxidase are on the lower side. But if I know that the lysyl oxidase levels are optimal, but it's the inflammation which is leading to progression of the disease, I would address that part of it. So once we have this in hand, I think we have to have an algorithm of where to choose a gene therapy and where not to choose a gene therapy for these patients. So
And
it's
we
not
have-
going to be for everyone.
Yeah. And we have already identified the predominant gene which is involved here. Is that
Yes,
right?
so we have identified predominant genes here, and that's why we are looking at the enhancing the lysyl oxidase expression.
Thank you.
Thank you.
One thing, Ashish, is when we talk about genes, they have a lot of crosstalk. One crosstalk which I feel has a huge advantage, not just in cornea, in everywhere else is, when we altered this gene, it drastically reduced the inflammatory pathway. So that inflammation for some reasons was knocked off. For example, the MMP9, and she must have shown. So what really happens is it gives you a collateral thought process that when you create a gene therapy, say for ARMD, like what Thiru and the people working is, you might actually knock off a pathway which is not the gene itself, but the molecules which is inflammatory, which can offset the thing. So this is something which we learned very new. So tomorrow, the gene therapy could be an effect for Steven Johnson when cornea is getting lysis or a scleral melt, where you're looking not just creating a collagen there, you're offsetting a pathway. So there is a completely new aspect which probably we don't know.